Welcome everyone to today's Discovery Hour with Spectracell Laboratories. This is Javier Sandoval from Houston, Texas. We'll be discussing energy optimization and sports medicine, presented by Dr. Callum Cowan, and we appreciate his participation and being one of our presenters. He's going to be able to speak volumes from a position of strength. And like I said, we just appreciate you guys taking time out of your busy day to be able to participate in this. So before we get started, let me just talk a little bit about Spectracell and who we are if you're not familiar with us. Spectracell was established back in 1993. We're definitely the world leader in the lab industry when it comes to the sophisticated tests that we offer. We're based in Houston, Texas, which is home to the world-renowned Texas Medical Center. I'd like to kind of consider us a boutique laboratory. As I mentioned, we specialize in personalized disease prevention and management solutions with state-of-the-art technology. The type of tests that we offer are extremely unique and unheard of, but more beneficial to anything that you may have seen before. We are a CLIA certified lab, and we've tested over 1.2 million individuals in the last 30 years. We've got global relationships throughout North and South America, throughout the Caribbean, Central America, throughout Europe, and some of our furthest accounts are in Israel and Dubai. With that being said, let's talk about Dr. Callum and the individual that he is. Dr. Cowan is known as the Phenom Doc, as a board-certified naturopathic doctor and a functional medicine practitioner, specializing in high performance and sports medicine, which is the reason we felt he was the most appropriate person to deliver this presentation today. With a decade of experience, he has worked with the top NHL players, UFC champions, Olympic gold medalists, elite executives, millionaire entrepreneurs, and Fortune 500 companies. He's the founder and team lead at Phenom High Performance Medicine Clinic, and Dr. Cowan's programs blends evidence-based strategies with practical insights to optimize health and performance from the inside and out. So sit back, relax, no need to take notes. We will share with you at the conclusion of this presentation the actual recording and even the slides themselves. So enjoy the presentation, and at this point, I'll turn it over to Dr. Callum Cowan.
Thank you very much, guys. I really appreciate you having me, and I'm very excited to teach about energy optimization and sports medicine. So as Javier said, I've been in this field for a long time, so over 10 years working with the most elite athletes, and it is very crucial to have energy optimized for so many aspects, and we'll go into detail on those today and talk to you about some of the cutting edge stuff that Spectracell is doing in terms of in-depth analysis. So the role of sports medicine, so obviously sports medicine is broken down to a few different areas. So injury prevention being the first one. So we want to identify those risk factors, especially for elite athletes who are being paid quite well to play the sport they're in and play at a high level. We want to prevent injuries in terms of performance enhancement, improving strength, endurance, flexibility, and overall athletic performance. Targeted care is very important, and that's something that I've been doing obviously for a long time with elite athletes, and I'm also on staff in the NHL and in the OHL as well. So I work directly with players on individualized treatment plans. So lab testing them and optimizing them on an individual basis. From a rehabilitation standpoint, so again, from a team environment, we're working closely and integratively with the physiotherapists and the other practitioners there working to rehab injuries. And then from a holistic health point of view, so how do you maximize overall well-being and mental health and nutrition and lifestyle? So sports medicine is quite a broad category, and these are some of the most important aspects. So within Spectracell, there are a few really great tests that they offer that are quite unique. So the lipoprotein particle profile. So this is an incredible test for athletes and for anyone, but it offers a detailed analysis of lipoprotein particles, including size, density, and number. So this has the potential to help improve endurance and also reduce cardiovascular risk. NTHFR genotyping. So this is looking at how well your body is methylating, essentially looking at folate metabolism and homocysteine levels. and then a tailored dietary and supplement recommendation to optimize energy there. And then obviously micronutrient testing, which is crucial. And I've been using this for over 10 years with our athletes. It allows us to see very specifically which nutrients are deficient, and most importantly, from a cellular perspective, which we'll get into detail on today. It also helps look at muscle recovery and fatigue from a nutrient standpoint, minimizing oxidative stress and omega-3 fats for concussion protection and recovery, which is essential in sports these days. So within sports nutrition, there are obviously some very key nutrients that you need to make sure are optimized at the cellular level. So these are just a few of them. And these are tied into energy as well, which we'll go into detail on. But these are some of the big ones. So carnitine, glutamine, which people know as critical for gut health, coenzyme Q, which is critical for mitochondrial function, lipoic acid, glutathione, cysteine, vitamin C, for collagen synthesis. And vitamin C is also important, obviously, immune wise, but keeping that connective tissue strong is critical for athletes. Vitamin E, we all know about the benefits of vitamin D, B vitamins for energy, metabolism, minimizing stress responses in the body, zinc, which is crucial for hormone production, testosterone, immune function, and then we've got magnesium, serine, asparagine, and carnitine. So very critical to have these nutrients in your system at the cellular level functioning to allow your body to work properly. So our whole philosophy at my clinic is if we can optimize what's happening in the inside of the body, it will translate into optimal performance outwards. Just an overview of micronutrient testing. So this is a proprietary functional and intracellular analysis, which is different from other tests out there. It's measuring the functional level and capability of nutrients in the white blood cells. So this is where metabolism takes place and where micronutrients do their job. The way that I think of this is a generic blood test looking at nutrient levels is looking at how much sort of gas would be in your car. If you're using a car analogy, it would look at how much gas is reading on your gas gauge. And then at the cellular level, the micronutrient testing is showing how much of that gas is getting into the engine where it needs to operate. So you could have a lot of fuel in the tank, but if it's not getting to the engine, then you're not going to get the performance that you want. So this is not just a single test, but it's a series of tests repeated for 31 different vitamins, minerals, amino acids, and fatty acids. The way that it's done is a lymphocyte proliferation assay grows white blood cells in an optimal nutritional environment, and then manipulates the media to measure the growth rate differentials for each micronutrient. So it's completely different from a serum blood test. So this makes it more functional versus static. As you can see what's actively working in the cells. Many diseases are largely caused by cellular deficiencies, so correcting these is crucial for longevity and preventative health as well. So micronutrient testing, how is it measured? So we use the T lymphocytes, so T cell lymphocytes, as the cell in which to measure the micronutrient function. So why T lymphocytes? So in most patients, they're available in large numbers. They're easily collected, they're transported and grown in culture. And T lymphocytes may be mitogenically stimulated to proliferate. So unlike other cell types, it has a complete protein, carbohydrate, lipid, and nucleic acid metabolism occurring within it. And the lymphocytes have a nucleus, which is critical. The other blood tests wouldn't have the nucleus in there. So the T4 lymphocytes play a key role in cell-mediated immunity. In a healthy individual, the T4 cell population is sufficient to be isolated and distributed across microtiter plate walls. So maintaining a high level of T lymphocyte proliferative response is crucial for health. There's even research done at Rice University to demonstrate that if mice are fed diets in specific B vitamins, that the mouse lymphocyte will become functionally deficient. So if you've seen a Spectracell micronutrient test, you may recognize that they're reporting something slightly different in terms of units. So you'll see it reported in percent growth. So the Immunodex, the Spectrox, the vitamin D, B12, and magnesium, as you can see on the left side there, are in percent growth. So all of them are reported in percentage growth, whereas a non-functional test, a static test, you're looking at units of mass per volume. So it's completely different in the way it's being presented. So the role of ATP in sports performance. So what is ATP? So ATP, or adenosine triphosphate, is the primary energy carrier in cells. So the test can provide reports and accurate data on your cell's ability to convert food into ATP. So this highlights how cellular function impacts your overall energy levels. And this is very important. I work with quite a few young and developing athletes and our prospects and athletes on the way. And we always tell them that, the food you eat is crucial, but you need to be converting that into ATP. So ATP is the end result of that. So having really good nutrition as a foundation helps that. But then knowing which nutrients you're missing specifically is critical to know. You need to know that. Um, why is it important in sports performance? Why is it important in sports performance and your energy level? So ATP obviously is going to allow your body to function at its peak. So in terms of speed, strength, precision, cellular function, in terms of absorbing, metabolizing, building, and repair. Nourishment, so micronutrients are vital for physical and metabolic optimization, which is often overlooked. Micronutrients enhance cellular performance, and then ATP production is the base of that. It's absolutely critical to have the ATP being generated. Something I always tell our elite athletes too is it's very rare to see an athlete with low energy and high motivation. So you've got to have things working physiologically to allow you to push into those peak levels of performance mentally and physically. So what are some common reasons for low energy? So obviously sleep quality is one of them, but sleep quality is also impacted by micronutrient levels. So things like B vitamins, zinc, copper, magnesium, they regulate hormones, including sleep hormones and neurotransmitters. So you need to be mindful of having those levels where they should be. Blood sugar control. So obviously proper micronutrient levels help you to respond to different carbohydrates and high glycemic meals, which are common for athletes. I know for our NHL players, we're actually using a lot of high glycemic foods for them to boost performance pre-game. But you need to be able to have the micronutrients there to be able to utilize those high carb and high glycemic meals. Cellular metabolism. So your mitochondria, which are the powerhouses of your cells, they need micronutrients to make ATP. So we talked about how ATP is critical. Well, your mitochondria needs very specific nutrients to be able to work and generate that ATP. Thyroid function. So thyroid has a huge role in metabolism and circulation and a lot of different things. And selenium is critical for thyroid hormone to be produced, which also helps to prevent fatigue. Hormone production. So micronutrients are essential for producing hormones like testosterone and progesterone. Anemia. So adequate micronutrients are needed for red blood cell production, preventing fatigue, and overall energy improvement. So the big sort of take home message here is that regardless of the reason, correcting micronutrient deficiencies is an appropriate way to improve energy. So the food you're eating is critical, but how much of those nutrients from the food is being extracted? And then do you have the right amounts of those nutrients that help move that food into ATP, which gives you energy to drive all the performance features of how your body's working? In terms of fatigue, there are some specific nutrients we are looking at. So these are the main ones here. So you'll see some similarities from the opening slide with different nutrients on here. But things like chromium, which helps with the glucose uptake, which we talked about for those high carb meals, coenzyme Q, which helps your mitochondria work optimally, B vitamins, which help to drive your whole metabolic chain to generate ATP. So each sort of nutrient here plays a role in fatigue. And the big picture here is that you want to make sure that your body has optimal levels of all these nutrients, so everything's working the way it should. So who should test? So if you're experiencing any of the following, so things like weakened immune system, low hormone levels, feeling tired daily, high caffeine consumption, which will allow your body to dump nutrients out and dump electrolytes out. If you're constantly yawning, that's a sign that your body's looking for more oxygen to bring in, and there's a deficiency there nutrient wise. If you need to take a nap during the day, if you're trying to bring your weight down or bring your body fat down, if you have low stress tolerance, and if you're irritable often. So, if you're an athlete or anyone seeking better health to ensure optimal cellular function and well being, it's a good idea to look at your micronutrient levels. So, we have a collection of elite athletes at my clinic and that I work with on the different teams. But my clinic, we have about 80% of people from the general population that are looking to feel better and function better. So, we have this test for all of those patients as well. So, we're looking at improving everything, and knowing your nutrient status is essential for that. So this is just a case study, a 52-year-old female with multiple symptoms. So her main complaints were stress, lack of sleep, low energy, depressed mood, and anxiety. She has a family history of breast and ovarian cancer. Her medical history: she had a breast lumpectomy, a partial mastectomy, chest irradiation, bilateral salpingo-oophorectomy, and she's gluten intolerant. On her micronutrient test, she showed deficiencies in oleic acid, zinc, glutathione, cysteine, vitamin E, selenium, CoQ10, lipoic acid, and vitamin C. So quite a few deficiencies, and the gluten can play a part in that as well. So when you're thinking about absorption of nutrients, gluten intolerance, you may have irritated the gut lining as well, where you're not absorbing nutrients as well. So it is common to see quite a few deficiencies when you do have some gut issues or intolerances to food or food sensitivities. So the supplement protocol for her and additional recommendations. So this patient was prescribed the following supplements. So calcium citrate, magnesium, vitamin D3, omega-3 with EPA and DHA, zinc 25 milligrams daily, NAC, vitamin E, selenium, CoQ10, lipoic acid, and vitamin C. She was also advised to perform some weight-bearing exercises 5 times a week for 30 minutes and to use a testosterone cream. So these recommendations were, the goal is to improve overall health, energy levels, and quality of life. The patient experienced a lower risk of hip and spine fractures, resulting in fewer hospitalizations and a reduced need for long-term care. Monitoring antioxidant and nutrient levels, along with encouragement to exercise, lowered her risk of cancer recurrence. She reported a higher quality of life with improved well-being, better nutritional status, and hormonal balance. And she reduced her dependence on anti-anxiety medications, leading to lower prescription drug costs. So this is a great example of how someone who's experiencing a wide range of symptoms, including low energy, we were able to target with very specific understanding of her deficiencies and then go in and correct those. Myself and my team at my clinic sort of view this as a precision medicine sort of approach, where we can figure out exactly what the issues are and go and target them to get improvements. And we are a results-based clinic, so we do see a lot of improvements when we can be very targeted like this. So some great improvements from this 52-year-old female. So a few frequently asked questions. So the number one question I get is, how often should athletes undergo testing to monitor their health and performance? So depending on the level of athlete, but in general, sort of every 3 to 6 months is ideal. So with the professional athletes, I'll test them every 3 months. And as you know, depending on their training schedule, their what's time of year they are in their season, what's going on with them stress wise, injury wise, their nutrient status will change often. So I usually check that every 3 months with the professional athletes, and then developing athletes at the latest, probably every 6 months. Um, what role does mental health play in sports medicine, and how can it be integrated into an athlete's overall plan? So mental health is very important. Mental health essentially is your quality of life, and the quality of life will dictate how well you can perform and function. And the way that we view it is that if everything's operating physiologically well, will put you in a good space to feel well mentally. So as we saw in some of the examples, when we correct some of these deficiencies, reducing anxiety, improving mood, improving focus, and obviously if you're improving all those things and performance is getting better, it's sort of a positive cycle where you're making more and more improvements. um, but mental health has become more and more of a sort of a need and demand, and you can definitely help people by looking at what's happening nutrient status wise. Um, Next question is, what if I correct one micronutrient deficiency but not all of them? So if you correct one of them, it will definitely help in some ways, but obviously everything's working together. So the body is one integrated system. So I really want to target improving all of those types of things when I'm working with an athlete. So, you can improve one, which is great, but really you want to be thinking of the big picture and how can you get everything working better. And you need to know where you're at testing wise, make the improvements, and then you can retest and see which things have improved and continue working on the things that haven't. Um, I thought energy comes from calories and not micronutrients. Isn't that true? So energy comes from calories in the sense that it's producing energy, but your body needs to convert that food into usable energy in the body, which requires your whole metabolic cycle, which is driven by nutrients. You actually need very specific B vitamins and different vitamins and minerals in that whole metabolic chain to allow the food to convert into ATP. So if you're missing nutrients in that chain, that production of ATP becomes very inefficient or maybe doesn't work well at all. So the end goal is using food or calories, but then you want to move them through your body to create ATP, and ATP goes around your body and provides your energy. It's the currency of your body. So if we're thinking of a car analogy, ATP is like the putting the gas in your car to make it work. Isn't being tired a normal part of life? Yeah, it's not actually. So being tired at certain times is okay, or for short periods of time after major bout of exercise or things like that. But in your general day, you shouldn't really be having any crashes or dips in energy or need to go and take a nap. You should be able to get out of bed easily in the morning, have good energy and focus throughout the day, good stamina throughout the day, and at nighttime have everything um, energy drop and allow your sleep hormones to kick in to get good deep restful sleep. So being tired isn't a normal part of life, but what's interesting is, and I see this a lot even with elite athletes, is if you get used to something for a long period of time, it becomes your normal and you lose sight of how much better you could be functioning. um, Often the first comment I'll get when we correct nutrient deficiencies from our athletes is, wow, I can't believe how much better I feel. I wish I would have done this sooner. I actually got a message from one of our pro athletes today saying he's 2 weeks into improving all of these things nutrient wise. And I can't believe that this is how much better he could feel. And he's at the top of his game in his sport. So pretty interesting to hear that. Um, I have thyroid problems. Shouldn't I correct issues first? So you always want to see your physician and work with your physician for thyroid issues and things like hypothyroid or autoimmune thyroid issues, and check what levels are at, and what your thyroid hormone's doing, and how well you're converting from T4 to T3, and what your thyroid antibodies look like for sure. But providing your body with the right nutrients to allow your thyroid to work is important. We talked about selenium earlier, and there are a few other key nutrients, but selenium is a major contributor to thyroid hormone production. So we'll help improve that. Can chromium deficiency affect my energy level? So chromium plays a major role in blood sugar stability. So it allows you to keep your blood sugar balanced throughout the day. If you can keep your blood sugar balanced, you can keep your energy consistent throughout the day. So chromium definitely has a role in energy level. So it will help to control and distribute the carbohydrates that you're taking in food-wise. Is fatigue or low energy an actual medical condition? So fatigue or low energy aren't an actual medical condition on their own, but there are things like chronic fatigue syndrome and hypothyroidism, which will create a lot of low energy and fatigue. So sort of like a indirect connection there, but there's a lot you can do to improve those things and move yourself out of low energy and fatigue. Oh, there we go. Yeah, so in terms of energy optimization and sports performance, there's so much you can do to improve yourself no matter what level of sport you're at. I always say the food you're eating is important, but what you absorb is even more important. So what you absorb is reflective of what's getting into your cells, which is what really matters. So I highly recommend getting those things assessed properly and then making strategic changes and see the improvements. Athletes are very used to working extremely hard in the gym and in their sport. And we're always trying to encourage them to take their nutrition and what they're doing supplement wise and how they're kind of treating their body in the gym needs to be as important as what they're putting in their system, and getting understanding of what levels they're at is a really good first step and good baseline to know. I think it's a no-brainer for anyone looking to perform better and improve energy to know this information and start making steps to improve it.
All right, Dr. Callum. Well, we appreciate it. That was an amazing presentation. And I think you said it best. It's not what we eat, but it's what athletes absorb, right? And these are elite athletes that you're dealing with on a day-to-day basis in your profession. And I think that the points that you made are not only for athletes or individuals that know athletes, but for every individual that can benefit from this, whether it's the micronutrient test that he went over in depth, or the lipoprotein particle profile, which is one of our cardiovascular tests that is significantly more informative than just a standard lipid panel. The MTHFR gene mutation is important too, as he mentioned about methylation with homocysteine. And if you have never had that done, it's a genetic test that only needs to be done once. And then he covered the energy optimization as well. So this is just 4 of the tests that we offer here at Spectracell. And for those of you that were listening in and participating on this webinar, we appreciate your attendance, and we'd like to offer you a coupon code that's good for the remainder of the month, and that is SPORTS10. So SPORTS10 will give you 10% off of these 4 tests that he mentioned today in today's webinar. And Dr. Callum, we can't say thank you enough for your participation. It was an amazing topic that you were able to cover from a position of strength, and we thank you. So with that being said, this is Javier Sandoval from Houston, Texas at Spectracell, signing off. Everyone have a great day. Bye-bye.